Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. We're announcing a 35th death due to COVID-19. This is a male in his 70s from the Rural East District in Southern Health. This was a previously announced case, and this takes us to 8 COVID deaths since October 9, and I want to extend my condolences to all those families and loved ones. Our current 5-day COVID test positivity rate is 3.5%, and 124 new cases of the virus have been identified as of 9:30 a.m., bringing the total number of cases in Manitoba to 2,779. Of the 124 new cases, 26 were identified Monday, 83 were identified on Sunday, and 15 were identified on Saturday, and that was due to a backlog of cases at that time. This backlog has been alleviated, and we're up to date on our public health information management system at this time. So over the weekend, extra staff were brought in to address these delays, and we're now caught up. Note that anyone who is awaiting test results is required to self-isolate if you're symptomatic, and this data delay should not affect that spread of the virus. So today's data shows 16 cases in Interlake East, 1 case in Northern Health, 3 cases in Prairie Mountain Health Region, 9 cases in Southern Health, and 95 cases in the Winnipeg Health Region. We have 1,248 active cases and 1,496 individuals as recovered, 28 people in hospital, 5 of which are in intensive care, and the number of deaths due to COVID-19 is currently at 35. As far as lab testing goes, we had 2,383 on Friday, 3,311 on Saturday, 2,049 on Sunday, and 2,188 completed yesterday, bringing our total number of tests to 213,669. 3 new additional testing sites, 2 in Winnipeg and 1 in Brandon, will open in the next several weeks, bringing the total number of drive-through tests to 9 in Manitoba, which will remain available on a first-come, first-served basis. The drive-through site at 1066 Nairn Avenue opened today, 7 a.m. to 7 p.m. The additional Winnipeg location at 125 King Edward Street is expected to open in late October. And a drive-through site will be open in Brandon at the Keystone Centre on October 17th. Work is in a development to reduce wait times at these testing locations by introducing an appointment-based scheduling system. Manitobans who are experiencing COVID-19 symptoms will be able to call or go online to schedule an appointment to get tested. The appointment system, including details on how to schedule appointments by phone or online, will be rolled out in the next few weeks. Again, discussions are underway with Doctors Manitoba to enable community family physicians to provide after-hours COVID-19 testing to bring testing even closer to home for Manitobans. An outbreak has been declared at the Headingley Correctional Centre. The site is moving to critical, red, on the pandemic response system. There are currently 7 inmates and 2 staff, and approximately 150 inmates self-isolating. The facility has taken measures to mitigate risk, including separating contacts and cases from the rest of the population, coupled with the use of appropriate personal protective equipment. And the investigations are ongoing, and I believe that the cases are linked to a previously announced case and a staff member. Further mitigation is underway. All visitation will be discontinued. There will be no further transfers or new admissions, and enhanced personal protective equipment for staff, which includes medical masks in the impacted areas. And these measures are expected to be in effect for 1 incubation period since the last case has been identified. So, of course, there's concerns with the number of increasing cases in the Winnipeg metropolitan region. Many of these cases are linked to close, prolonged contact with people who have tested positive with COVID-19. The widespread transmission makes it harder to target specific public health interventions. We are just 2 weeks into the restricted period for the region, and just under a week into the further restrictions with the bars and restaurant sector. So we are seeing numbers now that of exposures that occurred 10 to 14 days ago. So we're going to continue to monitor the situation very closely, but we'll, we need to step up now with Manitobans. We've been through similar things in the past. We know how to limit this spread, and it's to reduce our contacts with those outside of our household. So we need to all be thinking about ways to reduce those number of contacts. So physical distancing, hand washing, staying home when ill, and just limiting that contact with those outside of our home, especially when we're at any of us who are at significant risk for serious outcomes. We've seen 8 deaths since last Thursday, and these tragedies underscore the need to protect those who are most vulnerable to this infection. We know those over age 65 and those with underlying medical conditions are at the most risk of severe outcomes. And the best way to protect them is to protect ourselves and to limit the transmission of this virus in our communities. So we need to decrease the amount of contacts we have outside of our households. The more people you interact with, the more closely you interact with them, the more indoor, public, crowded places you're at, you increase your risk of transmitting that virus. So please practice those fundamentals at all times, and we'll have that impact on decreasing the transmission rate in our community. So if you do choose to go out with your friends or family, you need to take those steps to reduce that risk. Like we said, staying home when you're ill, even mildly ill. We still see cases identified now that were out and had many contacts when they had symptoms, and it's entirely avoidable. We know that transmission can occur in asymptomatic people, and so the contacts before that are, difficult to predict. And that's why we just message to reduce the amount of contacts you have in general. But a number of these cases have exposures to others when they're symptomatic. So we just cannot succeed in this pandemic if people are out and about when they're symptomatic. Our travel restrictions last week, Public Health Agency of Canada introduced exemptions from the Quarantine Act requirements for self-isolation were related to compassionate and caregiving reasons. So our travel orders, including the Northern Order, are being updated to reflect this. So people who are not displaying any symptoms of COVID-19 may travel to Northern Manitoba to care for a family member or a friend who is seriously ill, but is whether in or outside of a healthcare facility, visit a family member or a friend who has a life-threatening illness within a healthcare facility, or attend the funeral of a family member or a friend. These individuals are required to self-isolate, other than the reasons for those compassionate reasons, however. And these changes will be reflected in the orders being signed today. Finally, complementary counseling services to address the need for additional mental health support will now be offered through expanded mental health virtual therapy program. The service was set to begin today. Will offer up to 2 counseling sessions by phone or video, and will be available in multiple languages. This complementary service will be offered until December 31st, when the program will be evaluated. So you can call toll-free at 1-844-218-2955. And thank you. I can now open up for some questions.
Dr. Roussin, the man who died in his 40s over the weekend, what can you tell us about that person? Did they have pre-existing conditions? This is the youngest person to die so far.
Yeah, and to my knowledge, There were no pre-existing conditions that were known at the time.
What does that suggest?
Well, I think it's very rare happening with this virus, but we know it to happen. People over age 65, those with underlying medical conditions, are most likely to have severe outcomes, including death. Those that are younger and healthier are much less likely to suffer severe consequences. However, it does happen.
And that person are in intensive care?
I don't know specifically on that individual.
Dr. Roussin, what would it take? You've mentioned previously in the pandemic response system, the conditions that would send us red. I know you just said it's only been 2 weeks, but what would it take to begin without shifting us to red, to begin other restrictions? How close are we to shutting down restaurants, essentially?
Well, we're right now following these numbers quite closely, and we have to look for that targeted approach. We know that a lot of the suspected transmission was occurring later night in some of the bar and licensed settings, and that's why we took this approach, and we're still fairly early on that. We know in the pandemic response system that we have posted online, there's a number of options in the orange restricted category for a number of sectors. And so we are, looking right now on what further restrictions could help with limiting the transmission. Again, it's very clear that these type of restrictions have severe impacts on individuals, on businesses as well. So none of those moves are taken lightly.
What specifically are causing this latest spike in Winnipeg? I know you've talked about prolonged close contact, but can you go over where the contact tracers are finding the heaviest categories?
Well, this is some of the challenge is that we're not finding really targeted areas in the city. We're seeing transmission in many age groups, seeing transmission occurring in different venues, within households, within gatherings. And so what we're seeing here is increasing community-based transmission, which makes it very difficult to take a very targeted approach.
But under your pandemic response system, that's a precondition for going red.
Well, if we're increasing the level, so we are at orange, and we're going to look to see if there's any other factors within orange that we need to get to.
What's the community transmission rate for Winnipeg right now?
Well, right now in Winnipeg the numbers are 21 non-EpiLink cases in the last 7 days. Now consider that we have almost 100 cases just in Winnipeg. So if 20% of those are non-EpiLink, which we've been seeing, we doubled that number.
What's the test positivity rate for Winnipeg?
Winnipeg is large and complex contact investigation. So we've had to, shift a lot of resources into the contact tracing. We have a number of things on the go right now to further bolster that. We are keeping up at this point, but it is a challenge. We're being strained.
What's the average time it's taking now to get to all the contacts?
Well, in certain cases, in some of the complex cases, it can take 6 hours of public health nursing time to fully resolve a complex case.
And you're still doing follow-up with those who have been tested positive? You're following up
That's
every
right.
day
So
with
we
them
do
to see if they're still self-isolating and
Right.
to inquire as to whether they're symptomatic or not, those
Right.
kinds of things?
Yeah, so we do active daily monitoring of both contacts and cases. The contacts are getting done largely by our call center. The cases are still being done largely by public health nurses, and so that's another opportunity where we can shift some of that work away from public health nurses.
What's the threshold for health officials to increase restrictions in health regions as cases go up? Is there like would restrictions be targeted to neighborhoods or entire health regions?
Yeah, I don't think it would make much public health sense to target it to an area as geographically narrow as a neighborhood, just because, remember, these are where people live. This is the address on their health card. It's not where they're acquiring it. So it's unlikely we'll have restrictions more narrow than, say, a large metropolitan area or a health center or a health region.
Doctor, as of yesterday, we had 75 cases, or rather 74 alone at Parkview Place. That's an immense number of cases in one facility. Aside from the usual, what is the province doing about that particular institution?
Yeah, so we're watching, we're involved in that very closely. We've been in touch with the operators. We're making sure that they're going to have, following the protocols. Things like, inspections are going to be done. We've provided an exemption to the one site rule because they're just the staffing levels are so hard to keep up with that many people self-isolating. And so, yeah, it's concerning, and, it just goes to show that, again, we have to protect these facilities. Once that virus gets in there, we have so many vulnerable people in those facilities. And the ultimate best way to protect those facilities is to limit community-based transmission.
How many cases at Parkview Place, latest to your knowledge?
Yes, Parkview is 60 confirmed cases with 5 staff members, 55 residents.
Okay, the Rivera disclosed 74 yesterday. Can you please give us a list of, we shouldn't, if you can every day, give us the care home outbreak numbers?
Yeah, we can probably just try to publish that someplace if we can. There's the only other change that I'm aware of is Heritage Lodge is at 12 confirmed cases, and those are all amongst residents.
What kind of inspection would the government be doing at Parkview Place? What would you be looking for?
This would be the typical standards. We have typical these type of investigations that go on routinely. And so a lot of them have been on hold during the pandemic, obviously, because of trying to limit numbers. So if an investigation took place, it would certainly be with the least amount of people required. They would be wearing a full PPE, full screening to ensure there's no introduction of the virus there. But they have a list of standards that they will review.
So is there concern that those standards are not being met presently as this outbreak?
Well, I think when you see a number of cases like this, we just have to make sure. So we don't have any specifics that they're not being met, but when we see numbers like this, we just have to go make sure.
Related to the exemption question that you announced at Parkview Place, we are told it is short-staffed. What's the province doing to ensure that there is enough staff there?
Well, I mean, I think there's a number of stakeholders that we can work with to try to help that out. Immediately the biggest action was to lift the burden of the one site rule for that. So, and then we'll just continue to work with them, ensure that we have enough staff there.
Where will the results of that inspection, when it takes place, be published, and will it become publicly? Can we see what's happening?
Yeah, I don't know what the process is for that. We have, it's not public health going in and doing that. We have a standards area that does that, so.
Do you regret consulting with businesses and waiting before the additional restrictions were placed on Winnipeg, both 3 Mondays ago and last Wednesday?
No, I don't think so. It didn't leave much of a delay to us. I think that we've learned before in a few instances where, there might be restrictions that public health thinks would work quite well, but when it is implemented right at the business level, it may not, in fact, be what we were looking. So I think it's always important to, whenever we can, to try to work with those sectors, try to get adequate restrictions in place that are really going to translate into effects.
How would you characterize the support you're getting from cabinet?
Support. I mean, I think we're working together from the beginning, and so we I present with them the epidemiology, the update. We work on a number of committees that report back up through deputy ministers, through ministers, and. And I think there's always been that support there.
Those people who went out and were symptomatic and infected other people, any of them facing fines? Any of them getting fines?
Well, there really isn't a fine for that, right? They weren't diagnosed as a case while they did that. So again, we when somebody tests positive and gets a fine, and it gets out there, that might deter someone from wanting to go get tested, because, so we have to balance that. So none of those people there, but we got to get that message out to people, is that we just can't get ahead on this if we have somebody going to multiple venues while you're symptomatic.
Big picture, we have all our categories of vulnerable places now. 3 jails now, Remand Center and Milner Ridge on top of Headingley. We've got remote First Nations, we've got personal care homes, and we've got this huge spread in Winnipeg. I mean, what can you say to the people in Manitoba who are starting to lose confidence here?
Well, I think that we're in a pandemic, so we're going to see cases. You're going to see cases worldwide, and we're likely going to see them worldwide for the near future. We're going to see periods of time when our cases are climbing. We're going to see periods of time when they're declining. Right now, we have to keep in mind that one of the biggest goals of a pandemic response is to minimize severe outcomes and the burden on the healthcare system. And also to minimize the impact on society, the societal disruptions. And so right now, we're not seeing that strain on our healthcare system, but we do know that that burden often lags behind cases. And can move quickly if we don't get ahead of it. So right now, we're not seeing that strain on the healthcare system, so we're going to continue to watch things. We get the message out that, every Manitoban right now today can minimize their own risk of acquiring COVID, and we all know exactly what to do.
What kind of demand on the hospital system would you have to see to start becoming concerned? You got about 25 people in hospital and 4 or 5 in ICU.
That's right.
What kind of numbers would you have to look at? I mean, over 100 people in hospital, 20, 30 people in ICU? Like, what would be a ballpark where you'd start to become concerned that, hey, we better act now because we don't want to be overwhelmed?
Yeah, so it's not necessarily a single number like that, because it also depends on what else we're seeing there. But it really, if we're not seeing vacancies in our ICUs, if we're not seeing those vacancies in in medicine beds, then that will get us concerning. So often in a severe flu season, we can have upwards of 30 people in ICU. With ILI, and so that's not the number. We're not looking for that number, but that's sort of a rough guide of the kind of numbers we can see during a real bad flu season.
What's your vacancy rate now? Vacancy rate for hospital beds and ICUs right now?
Yeah, they calculate the rate right now, and it's it varies, so it's a tough one to. We get reports on it from various factors. So I would say that with our healthcare system capacity right now in ICU, we're still in our green level right now.
How many ICU beds do you have?
Well, overall, they're in just different sectors. So I don't know if I have a complete list. We have ones that are active right now. We have ones that we can open, if needed. So. Right now our capacity is in green.
Dr. Roussin,
Did you expect to see this number of cases? 2 weeks ago, had you expected to see these number of cases today, and why?
Well, we were expecting to see increased cases. We knew that we were very likely going to see a second wave. We know that in previous pandemics, second waves, have sometimes been worse than the first wave. And then we also knew that it would be very difficult to go back to the level of restrictions we had during that first wave. Right, we had a lot of uncertainty in that first wave. We all had to have these blanket restrictions because we weren't sure what to expect. But now we know much more about the virus. We want to take that targeted approach, and of course that will be that we'll see more cases than that first wave. But we just have to make sure we're not overwhelming the system.
How many cases?
We've received reports from people saying their COVID-19 tests leaked during transport and were told to go back and get tested again. How many times has this happened that you're aware of?
So this is rare, and it's not unique to COVID-19. So I know as a practitioner, some things happen at the lab on a transport there. If the specimen is leaking, then it's a biosafety issue, so the lab won't process it. So it's not unique to COVID. It's a rare instance, but it happens.
How many cases do we have on First Nations as of the moment?
Yeah, I don't have an update on those total cases. I think for the First Nations, we'll direct to our partners for those questions.
Because we had 9 in the last time we checked. I'm not going to list them off here. How would you describe the situation at Little Grand Rapids, which was the largest?
Yeah, and so that's a concerning situation with a number of cases, number of contacts we've had. We have a number of people in isolation and in various parts of the province in the alternate isolation accommodations right now. So a lot of feet on the ground there, working this up. But with the amount of people that are self-isolating, with the nature of the exposures there, it's concerning. So we're going to watch it quite closely.
Why aren't Milner Ridge and the Remand Center considered outbreaks?
Yeah, just with the nature of the cases and the amount of contacts that are related.
Does that mean that their staff, the nature of the cases, what does that
I
mean?
don't have the specifics on those ones, but if we looked at, say, the in Headingley, the index case there, we knew had many contacts, and then so as we saw the cases developing, then we knew we should declare an outbreak.
Thank you, Doctor. We're going to go to the phone now. We have a number of reporters waiting, and we remind you, you get one primary and one follow-up. Up first from the Canadian Press, Steve.
Dr. Roussin, Steve Lambert from the Canadian Press. I'm wondering if you can explain the backlog in releasing the results, because we're seeing this very large number today. It looks like a single-day record, but could you explain why there are backlog? Because we got some numbers reported every day over the long weekend, but now we're getting additional ones?
That's right. So over the weekend, on mostly one day, there was a significant amount of positive results received immediately in the morning. And so what happens at surveillance is this gets inputted into the system. It gets referred out to the regions. So there is a process in place that requires workforce. And so because there was so many positive received at one time on a weekend, we got into a bit of a backlog on that. It was rectified right away, bringing in extra staff, bringing in overtime. But even with that, we had the backlog for that one day.
And so what's the real number for today, if I can use that term? Are we still trending up, or have we seen a drop if you subtract all the backlog?
Right. Yeah. And so again, it's so today the cases that were reported first today is 26 for today. But again, on these one day type measures, we can't really look at a trend on that.
From the Thompson Citizen, Ian.
Hi, Dr. Roussin. I'm just wondering, there's been 5 new tests positive in the Thompson Health District announced in the past couple of days. I'm just wondering if they're linked to a previously announced case on October 5th that's now recovered, or if the source of infection is unknown at this point.
Yeah, I don't really have much details on those cases. So the region will be investigating those. Let me just see if on my might have a bit of a clue on that. So the 7-day non-epi-link cases in NRHA is 3. So 3 of those cases are that we're unable to link to a known case at this time. Sometimes there's a delay in getting that information.
Okay. And do you think is adding exemptions to northern travel restrictions at a time like this, when like the cases are going up rapidly in Winnipeg and there's more cases being found in the north? I mean, is that going to put people in northern and remote communities at greater risk of being exposed to COVID-19?
Well, the travel restrictions in the north, we have a number of exemptions right now for business and economic reasons. These are very tightly related to compassionate reasons for caring for an acutely ill person or a critically ill person, visiting critically ill person, or attending a funeral. So these are just those that balance that we're trying to achieve with the restrictions. Certainly, people are required to self-isolate otherwise. but we just felt with the impacts of this pandemic on so many levels that we want to ensure we're showing compassion where that's needed. And I do want to note that we have these compassionate exemptions for our interprovincial travel restrictions as well, and our interprovincial travel restrictions as well. We're looking at furthering some of those exemptions to be closely related to our northern travel restrictions to allow more of the business opportunity, business movement, and so that should be coming shortly as well.
From the Brandon Sun, Emily.
Hi, Dr. Roussin. My first question is, if you are able to, or if this is something that we can get posted online, but could we get a regional breakdown of those backlogged cases that were added to the original daily totals over the weekend?
Yeah, I'm not sure if surveillance can do that. We're just working to keep up with all the cases and getting on to case identification, isolation, contact investigation. So I don't think they'll be working on that as well.
Okay, but the regional totals will be updated
Yes.
to include
Yeah,
any new cases that have been identified in those regions, so you could do the math yourself.
that's right. Yeah, so they'll all be directed to the appropriate region, the backlog cases.
Thank you.
From the Globe and Mail, Shannon.
Hi, Dr. Roussin. My question is about testing sites. More specifically, I know there's some new ones coming, but there's been an emphasis on drive-through test sites. So I'm wondering what the plan is for those who aren't driving as winter approaches. I know you talked about appointments, but people are still going to be outside. Are there plans for indoor testing sites where people can walk in?
Yeah, so there are walk-up sites, and so they're working on furthering that. And then, as I mentioned, we're working with Doctors Manitoba and medical clinics to offer assessment and testing sites. So those will also be of that nature.
Okay, but many of the testing sites where people walk up, people are waiting outside. Will there be an option for people to wait indoors if they don't have access to a vehicle?
Yeah, I guess it'll depend on the site, what they look like. We're going to have to make sure any such thing like that is safe, right? Allowing for the distancing. I think the appointment-based scheduling is going to assist with that as well. So these are all the things that are being addressed.
From City News, Jonas.
Good afternoon, Dr. Roussin. I just want to touch back on the death of the male in his 40s. I know due to privacy and everything, we can't discuss a lot about it, but I just wonder if you could walk me through his case. I mean, this is the youngest individual we've seen in the province yet, no pre-existing conditions. Just a little elaboration, if you don't mind, on his case.
Yeah, so I mean, it's certainly tragic. I mean, anytime we see deaths like this, but you're right, as the youngest person, and from my knowledge, a healthy individual. But we're not going to discuss any specifics of a case. Our condolences go out to their friends and family, but I won't be discussing any other specifics.
Completely understand. Just wanted to ask her. And as far as where we are, as far as other hospitalizations, ICUs, are we seeing a rising case in younger folks as well? Younger relatively, I mean.
Well, we're certainly seeing increased numbers of cases in the younger individuals. We see that 20 to 29 cohort with the most number of cases in it, and so with that, we're going to see hospitalized and severe outcomes in that younger group. So even though it's rare, the more and more you have, then the more likely you're going to see these rare events. So we do see that.
From Global, Brittany.
Good afternoon, Dr. Roussin. Brittany from Global. What do you say to Manitobans who have taken, and Winnipeggers who have taken on these further restrictions, but our case numbers continue to go up every single day? Today, our highest single total that's been announced. How do we know that these restrictions are working, or are they?
So we know what works. We know what we can do about it. And so with or without the restrictions, Manitobans know what they can do right now, right today, to limit their own risk. And by limiting their own risk, they're going to protect people around them. And so we've been through those fundamentals. These restrictions just sort of put that added emphasis on the fundamentals that we know. And so it's a little bit early to know whether they've worked. And again, as we see numbers climb, where we continue to be concerned, we can't look just at the total numbers to know whether the restrictions have worked, because but for the restrictions, we might have seen even more cases. So it's really hard to judge, but absolutely, we're concerned with seeing these numbers increase, and we have to get that message out to Manitobans, to us, to our neighbors, to our loved ones, that we need to take steps right now today to decrease our own risk.
Thank you. And you talked about moving towards an appointment-based system for some of these testings. I'm wondering if you can just expand on what that means and where those will be located for people.
Yeah, so I don't have a lot of details. More will be coming for that, but it's essentially will be using a call center and an online or phone-based system to be able to make appointments for symptomatic people and direct them to different sites to try to streamline the process.
From CJOB, Marek.
Hey, Dr. Roussin. They put that system, the online system, in place in Ontario. We were hearing it often took longer to get an appointment. Do you guys have like a time in mind that people will be waiting an amount of days before they are able to get an appointment?
Well, I mean, it's still early. It hasn't been completed yet, but the idea is to have people in the same day that they're calling for if they have symptoms, right? So this is going to be for symptomatic people. Again, people without symptoms, we don't really want you going for testing unless you've been directed to. We want to use our resources for symptomatic people, and symptomatic people we want tested as soon as possible, and then we want them to self-isolate as soon as they're ill and self-isolate pending their results.
Thanks. And my follow-up is that the World Health Organization over the weekend said they wanted jurisdictions going forward to avoid COVID-19 lockdowns. What's your response to that from a Manitoba point of view?
So you're going to be careful with with that. It's the WHO didn't really change any position they have on this. All right, so our position has always been we don't want a lockdown, and that's the WHO's, right? They're not saying that lockdowns aren't effective or public health restrictions aren't effective. What they're saying is that we should be taking a more targeted approach to restrictions and having them at the least restrictive level and for the shortest amount of time. So the WHO isn't at all saying that public health restrictions aren't warranted or aren't useful. They're saying what we've always said is that these restrictions have significant impacts and they need to be targeted and they need to be utilized only when evidence-based.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. Just to kind of piggyback off that question, if we take out the economic impact, political implications, all that kind of stuff, what would a 2-week lockdown do for Winnipeg, at least at this point, in terms of fighting the virus?
Well, it's anything that we do that limits people's contact with others will decrease the transmission of this virus. And so we know that what we do now today is going to have impacts 10 to 14 days from now. And so severe restrictions on people being in contact with others in 2 weeks from now, we'll see a significant decrease in the transmission of the virus. So now we know that health is much more than just this virus. So we have to consider all of these type of things when we're making these decisions. But the big message is we don't have to have restrictions. We don't have to lock people down to get people to make good choices to reduce their exposures. So that's really what we're after, is to have the least amount of restrictions and have Manitobans limit their contacts, but still can do some of the things that they love and enjoy, but do it differently.
Well, and I'll piggyback off that then for my follow-up, but it seems obvious that, at least in some cases, that's not happening, and whether or not it's the majority or minority of people not doing it, it's a few people affecting a lot of people. So I guess in your medical opinion, then, without all the other stuff involved, like would you put this province, or at least Winnipeg, into a 2-week lockdown if that was an option? Then, I mean, it's obviously an option, but why aren't we not doing that to try to get a handle on this?
Well, I mean, the simple reason is that also has profound negative impacts as well. So we've seen a number of negative impacts from these lockdowns. So it's not, COVID versus no COVID. It's overall health. And so we know that lockdowns, shutting businesses, or limiting businesses have huge impacts on individuals. And it has huge impacts on individuals' health, just like COVID has impacts on people's health. So it's a very difficult balance to find. We know we can't let this virus just simply transmit in our communities, because we know what will happen if we have overwhelming numbers and overwhelm our healthcare system. But we can't simply lock down things every time, because really it's not going to be a 2-week lockdown. After 2 weeks, we'll be right back to where we were if we go back to the same activities. So we're going to be dealing with this virus for the foreseeable future, and so we need to find ways to deal with it without having to lock ourselves down every time the virus starts transmitting.
From CBC Radio Canada, Gavin.
Hi, Gavin from Radio Canada. Dr. Roussin, yesterday's release indicates that the 100-year-old person who passed away was a previously known case. It doesn't say the same thing about the 40-year-old. Was this case not known before this person's death?
The information I have, it was a previously reported case.
Okay, thanks. Also, last week you indicated that the number of active cases reported by the province is an overestimate. Do you have any idea about what the actual amount of active cases is like? Are we talking hundreds less cases, tens of less cases? What sort of numbers are we looking at?
It's likely hundreds of less cases. So if you think of the infectious period for this virus is 10 days for almost everyone from the onset of symptoms, and that's not even from the onset of their positivity rate. So typically we'll have a case being an active case for 10 days. And so if you look at, we have 1,248 active cases, that would tell us that over the last 10 days we've averaged 125 cases a day, and so we certainly haven't. So it's hundreds less than that, but I don't have a specific number. It'll be something that'll be updated over time.
From CHVN, Taylor.
Hi, good afternoon. My first question is about, with in mind the high demand for testing right now. If a parent sees that their child is sick, what should they do if they don't know yet if it's the flu or COVID and it's early on in their symptoms?
Yeah. So I mean, the message that we would have for this is stay home when you're sick. Certainly seek healthcare if you feel you need it. It's safe to seek healthcare. But for those individuals, we would suggest being tested as soon as possible and then to self-isolate pending results. So even if those symptoms resolved in a day or two, if you haven't got your results back, we would advise you self-isolating pending results.
And how soon will parents of students, either both in a cohort or in the school in general, know if a student has tested positive for COVID-19?
How soon are they notified?
Mm-hmm.
Yeah, so it depends on the case. It's usually the same day that Public Health receives the positive case. So Public Health will get the case reported out to them. They'll start their case investigation. If they find out it's a child who had been in school during their infectious period, then we work with the school to find out what's the nature of the cohort, was there distancing, and then right from there we make recommendations to the school on who should be notified and to self-isolate.
Thank you, Doctor. We now return to the news conference theater.
Doctor, are high schools going to remote learning only?
Are they going to that? That's not going to be public health's recommendation at this point. We see a lot of cases in the community, so you're going to see cases in the school. We're not seeing a lot of transmission in the school right now. So public health doesn't want to adversely affect schools or childcare.
And doctor, we're seeing shortages of flu vaccine in Ontario. Any here?
We're not seeing any evidence of shortage right now. We received a large number of doses already, and we shipped out already to our priority groups and have begun shipping right now to clinics and pharmacies.
Can you alternate isolation accommodations for folks on First Nations? Is that happening in Winnipeg? Are people being?
There is some of that, yes. Yeah.
Explain what's happening in that regard.
Well, so like we have, a lot of our alternate isolation accommodations are in Winnipeg, and that's for Manitobans. And so cases or contacts could be isolated there. So that includes our First Nation partners as well.
So people in communities in the north, how many folks from those communities are in Winnipeg today?
I don't have a number on how many are, but we do know that it is being utilized that way.
Can you confirm the man in his 40s died at the emergency ward?
I can't, no.
Would that be wrong?
If this trajectory continues this week, if the numbers keep rising at the rate that we're seeing in the Winnipeg region, can we expect to see some further restrictions announced by the end of the week?
Well, I think if we continue to see high numbers, those are the type of things we have to look at, right? What more restrictions can we put in to protect the health of the public? I would say that if we see increasing numbers, and showing increasing demand on the healthcare system, then that's even more likely to have to result in further restrictions. The challenge right now is because we're seeing that community-based transmission in Winnipeg, it's really tough to have any more targeted interventions. We've sort of went that way already, and we don't really have a lot of more targeted interventions.
You're running out of tools.
Well, targeted tools. Yes.
Yeah.
I have a follow-up question just about COVID testing. When people have been affected by spoiled samples, why aren't they given an expedited test?
So the testing at the lab, each sample is run about as fast as it can be run right now. So there's certain, that we're pooling those samples with it. Certain expedited tests, like for instance, a healthcare worker, what we sometimes do is not run that in the pool, so we'll get the test back right away quicker. Sometimes that's quicker, sometimes it's not. And so right now the labs at their capacity are running tests pretty much as fast as they can right now. So there isn't much ability to expedite any more tests.
Doctor, what's the John Pritchard School cluster up to now?
That one I don't think has remained 39 cases.
And doctor, further to Tom's question, if I had a restaurant reservation for later than this week, should I be canceling that?
No, that's not what public health is saying at this point. We'll update the public. We, a number of, probably the vast majority of that sector are doing everything they can to limit transmission. So we'll update if we're going to move to any more restrictions.
Further restrictions wouldn't come though unless there were increases in a variety of metrics, including the hospitalizations and the ICUs. In other words, rising cases on their own wouldn't necessarily result in further restrictions.
That's right, not necessarily. So we have to keep an eye on that. Certainly, the rising cases put extra demands on public health, on the public health system. So we have to keep that in mind. Puts extra burden on lab sometimes because as the test positivity rate increases, pooling becomes more difficult. So we do have to watch just the case numbers at a whole, but you're right, it's not simply that. We need to see other factors.
And hospital numbers, the capacity you said was at green, so that's good.
Right.
What would you place contact tracing resources at if you had to give it a color?
Yeah, and so that's a real tough one to measure. And so from right now, we're looking at the regions. And the proxies that we can measure, they're still in the amber or green with that. But we know with these cases, just the cases right now that they're actively trying to work up, puts a lot of strain.
When do you expect the recovered cases to be able to catch up? Because if we've only got that 10-day period, we haven't seen that recovered number move much.
Yeah, and so again, that's with the amount of cases that everyone's working on. We saw epidemiology are a little bit of a backlog this weekend, just getting the active cases out. That one's probably one of the lower priorities to catch up on.
Are you aware about a cluster of cases, perhaps at or connected to the Maple Leaf Foods plant here in Winnipeg?
No, I don't have any information on that.
And what about the Rosewood Retirement Home? Vera sent out a notice. Do you have any information about that?
Rosewood, I don't have any information. So, remember a lot of times that the cases come in, they'll report it out to the region, region investigates and starts all of the work on it, but it has to come back to public health, or to information surveillance, to get back to us here. So, often those places will be able to report it earlier than us.
What's the average wait time for health links at this moment?
I think I have that someplace. Looks like 60 minutes.
Okay, and what is the average time now to hear back about a result? Not the lab processing time, that's not been the big issue. What's the average time to hear a positive and negative result at the moment?
So that is the total test turnaround time we refer to. I'll see if I can find that quickly here. So maybe we'll just try to get that to you in a bit, but yeah.
And you were asked last week about the demand for increased test processing capacity once all these additional swabbing sites come up. How does that look right now? Will additional test processing capacity be needed?
Yeah, well, that's something that we're working on. There's a lot of challenge with that. Staffing, reagent, all that's in the works. Our median total test turnaround is 66 hours.
66 hours. Okay, you're making us do math again. 48. Okay, great. Thanks. Under 4 days.
Two more. Sure. On the lab capacity, in the short term, can we handle that increase in the swabs that are being collected? Do we have enough buffer until we get our capacity up to like 1,400 to 2,600?
To some degree, yes. We have that the overall capacity report about 3,000, but certainly in the short term, we can ramp up in the short term. Longer term solutions are needed with things like reagent.
Have you seen any evidence of reinfection in Manitoba?
No, haven't seen. We see a number of people who are recovered and then get tested again, and those will be positive. But we haven't seen much evidence or any evidence here in Manitoba of reinfection.
How do we have a rural east district death, but we didn't have a case there prior?
That it may not have been previously reported, or it may just been one of those things that wasn't reported at the same time.
Thank you for answering all of our multitude of questions.
Thank you very much.
That was a long one, I appreciate it.